Yeah. Hello everyone. Once again, you're welcome to our MRCOG 3 ADC. And now, this time we are going to discuss about the gynecology module. Today, we'll be discussing two cases from the gynecology module. So just let me tell you, gynecology means that module can cover both elective and emergency cases. And you'll be assessed all the domains. So that means the information gathering, communication with the patient, communication with the colleagues, patient safety, applied clinical knowledge. And then what are stations you can expect? You can expect menstrual disorders. Anything from menstrual disorders could be amenorrhea, either primary or secondary. Primary and secondary, they can go for hypothalamic or hypothalamic hypo, that's hypogonadotrophic hypogonadism. And then second thing, hypergonadotrophic hypogonadism like Turner's. Then they can also ask you secondary amenorrhea, commonly that is one hyperprolactinemia can be asked, and dysmenorrhea in a young girl, spasmodic dysmenorrhea can be asked, or congestive dysmenorrhea, it also can be asked with endometriosis as the diagnosis for congestive mostly, or pelvic inflammatory disease. So anything they can ask. And then coming to the heavy menstrual bleeding, which is very important. Heavy menstrual bleeding, it could be because of the fibroids or without any cause. So that all the management options you need to know. So anything they can ask from the heavy menstrual bleeding. And heavy menstrual bleeding can be in an adolescent or in an adult and reproductive age. So that is one thing. And heavy menstrual bleeding in mentally deranged also. That is also very important. And then they can ask about developmental abnormalities like MRCOG. And that's what the same thing. Puberty disorders like menorrhagia, and emergency gynecology case can be adnexal torsion. They can ask adnexal torsion. Then menopause. Menopause is very important. HRT. Everything you need to know about the HRT. You can read from the NICE guidelines. Chronic pelvic pain, very important. Mainly they concentrate on the endometriosis. Then transgender. Transgender, why I wanted to select this topic is it's a very confusing and confusing thing also. So transgender, they can ask a pelvic Bartholin abscess, Bartholin cyst or abscess, and also heavy menstrual bleeding also. Once it has come, heavy menstrual bleeding in transgender. So now today we are going to discuss about this transgender with an abscess, Bartholin abscess. That is in a Transmen. That is what is Transmen. Transmen is actually, this Bartholin abscess is in a Transmen. It is actually, they are assigned female at birth. So Transmen is assigned female at birth, but they are identified as male. Often they want to carry out masculinizing surgery. The options being, because she's female, want to go to male, become male. So they have the options of surgery like mastectomy, hysterectomy, ovariectomy, colpectomy. So these things. Plus the masculinization like phalloplasty, testicular and penile processes. So these are the things which are surgeries which they will be undergoing. So now coming to the station which we are going to discuss. You are an ST5 in the Department of Gynecology covering accident emergency. You are called to see Mr. Jack, 30 years, with partner Jasmine, 28. And he comes to the accident emergency with severe pain in the private parts and urinary complaints. He has been referred by GP, who is suspecting Bartholin cyst. And then some test reports are done, they are enclosed. So swab report shows confirm name, age, and NHS number, always confirm with the name given in the case scenario, John, and 30 years, and NHS. So it shows infection, that's with the Neisseria gonorrhea infection. Then there will be an image of the Bartholin cyst, a color image of the Bartholin cyst. Then or abscess, he has a doubt, and urine routine is normal. So now we have 10 minutes. You have to take the targeted history, explain explain the investigations and her answer concerns, and now explain the management plan. So how are you going to proceed now? So start the station with, hello, I'm Dr. Manjula, one of the doctors in the accident emergency clinic. May I confirm your name and age, please? Doctor, I'm Mr. Jack and I'm 30 years. So here is Jack. So you have to address him Jack only. So then I can see from your GP letter that you are suffering from severe pain down below and also have some complaints with your waterworks. Am I correct? Yes, doctor. I'm having severe pain. I'm very sorry. Always empathy. Because she is having pain, severe pain. I'm very sorry to see you suffering with pain. We are here to help and support you. I can see that your partner also is with you. Would you like her to be with you during our consultation? Because we need to confirm that whether confidentiality should be maintained or not. Hmm? So he says, yes, doctor, she'll be with you. She only brought me here, so she'll be with me only, no problem. So then, I can see that, now that is over. I can see that you are in pain. So shall I tell my nurse to give you some pain relief medications? Yes, doctor, I need some painkillers. So, okay, do you have any allergies to any painkiller? No, doctor, no. So, just wait for 1 second and see that means for the effect of the tablet to pass and to get the effect. And are you fine now to talk? Are you comfortable to talk? Now, can you tell me more about your problem? Uh, Open question. So he says, then can you tell me more about? Before that, you can say, can I ask a few questions to know more about you? So that we can maybe that will help in our management plan. Now, can you tell me more about you, about your pain? Because I see you're in pain. Can you tell me more about it? Then he will say, doctor, this pain, I have started getting this pain, severe pain. I'm suffering since 3 days. And this pain, and I have also noticed some swelling down below. It is increasing in size, doctor. The pain is increasing, the swelling is increasing, and I feel it is very hot. And I could see that it is red also. I'm not able to sit and stand or walk, doctor. I'm not able to sleep also. It is so severe. So you say, I'm very sorry. I'm very sorry to Jack. Can you tell me whether can you score the pain if the score is between 0 to 10? He says it's around 7 to 8, doctor. And did you notice any blisters or any ulcers also? Any down below? Any blisters, any ulcers? Or do you have any fever or pain in the tummy? Did you notice any discharge from down below or any bleeding? And any problem with the waterworks? Then because he already has pain in the pain comes urinary complaints. So he said, yes, doctor, I'm frequently passing urine and like 10 to 12 times I'm passing urine and also have severe pain also when I'm passing urine. So, and have you had any time infection in the urine before, in your waterworks before? Any time? No, doctor, this is the first time. How about your bowel opening? Do you have any problem with the bowel opening? No, doctor. So then, and doctor, because of my pain, my partner is very much concerned. So she brought me here to the accident emergency. I'm so sorry to hear, but we will manage. I like to solve your concerns. Now, I would like to ask a few personal questions. Can I ask? It may be intrusive. Can I ask? Always signpost. Now you're going for the sexual history. Always signpost. Yes, doctor. Yeah. So, can I ask you? Are you sexually active? Though her partner is there, you need to ask. Okay, are you sexually active? What type of sexual activity you prefer? Like you mean the anal or vaginal or oral? That's what type of sexual practices you prefer? Is it your first relationship? That means you want to know whether she had any relationship before. Instead of asking multiple partners this and that, you can ask, is it your first relationship? Then she will say yes or no. If no, then she will say, before this, what type of relationship you had? Then, do you use any safe sex practices? Anytime you or your partner had any sexually shared infection, like anytime you had any fever or pain in the tummy or discharge down below? Yeah. Yes or no, he will say. If he says yes, then you say, have been treated for that? What type of treatment? If he says no, okay then. I understand from your notes, Jack, I understand from your notes that you are in a new role. Where exactly are you in terms of your prescribed treatment? This is important, because he's going to want to become a trans man, so he want to know exactly where are you in terms of your prescribed treatment. So, what treatment have you taken for this role to achieve? What type of treatment are you taking or have you taken? I'm taking, doctor. I'm taking some hormone called. They told me that it is called testosterone, and so I'm taking that, doctor. So, are you doing a blood test regularly to check the hormone levels? Yes, doctor. The doctor asked me to check regularly. How are you coping up with this situation? Doctor, I'm fine. I got adjusted. And how about your gender assignment surgery? when are they planning for you? Yes, doctor, they told me that it will be done after 1 year. 1 year waiting period is there. Are you regularly visiting your gender clinic specialist? Yes, doctor, I'm visiting him. And can you check your documents? And do you have the gender specialist letter? If he says yes, I would like to. Can I see that gender specialist letter also? Because I need to know more about it. Yes, doctor. Now that is over. Now you're coming to the menstrual history. After sexual history, you're coming to the menstrual history. That's gynec history. See, Jack, few of my questions may make you very more unhappy. But as a clinician, I need to ask you a few questions. As you still have a womb, can I proceed? Yes, doctor. Can you tell me more about your periods? Sometimes they get angry if you ask about their personal periods and all. So, can I? Can I ask as a clinician? I need to know. Because you still have a womb. Yes, doctor. Can you tell me about your periods? Are you getting regular periods? Yes, doctor. The periods. Yes, I'm getting regular periods. When was your last period? When was your last period? Yes, doctor. 2 weeks before. How about your cervical screening? Are you doing regularly? No, doctor. I'm not going for the cervical screen. See, in terms of safety, I would like to tell you, it is advisable to regularly screen for your to know your health status of the neck of the womb, because sometimes any problem can happen in the neck of the womb. We may be missing, and that can lead to some complications also. So we advise you to go for cervical screening. Okay. So far, have you used any contraceptives? No, doctor, I'm not using. So now, here, just some break from the my conversation. Here, and did anyone notice notice a change in the reports, and also in the name of the patient in this case scenario? See, name of the patient is Mr. Jack, but in the report it is Mr. John. So we intentionally kept it to for you to know, like, this thing can happen. So always whenever you see like this, you have to say, this patient safety point of view, that report is not her report actually. So in his report, I mean. So this way it is very important to just intentionally we kept this, so that you will never forget. So always check check. But even if it is John, if you continuously tell to the Jack about John's report, that means you are compromising patient safety. You are telling somebody's report to him. So got my point? Yes. Now, coming to the medical. So have you been now obstetric history? Have you been pregnant before? Yes or no, he will say. Then medical. So now coming to medical history, are you on any long-term medication? Uh, Whatever he says, yes or no. So just you want to rule out medical conditions like diabetes, hypertension, anything, thyroid or anything. So now, any allergies? Do you have allergies? And just do you have any idea about your blood group? Okay. Now, surgery. Have you undergone any surgeries in the past? How about your family? Do you have any families of any concern? Okay. Now, can you tell me about your personal habits? Like, do you smoke or take alcohol? Pardon me for asking. Do you take any recreational drugs? If he says yes, smoking yes and alcohol yes, you say smoking yes means you say smoking. And let me tell you, Jack, smoking is not good for health. If you permit, it can do harm to the health. And if you permit, and especially harm, it can harm the reproductive. It will act on the genital organs also. So if you permit, I'll connect you to the NHS smoking cessation program so that they will help you to quit the smoking. Will that be fine? Same thing with the alcohol also, de-addiction. And so now coming to the BMI, do you have any idea about your height weight ratio? Or you can say BMI also. If he's on the higher side, again you say it is on the higher side. If you permit me, if you allow me, I'll connect you. Always take the permission. Don't take yourself decision that you want to refer to the like a dietitian and diet and exercise program or smoking cessation. You just ask them whether they would like and tell why you want to. So here also you say, if the weight is more, it also affects your health. So we will advise you, if we permit, we will refer you to the diet and exercise program. They will advise you the proper diet and exercise. So will that be fine? Yes, yes, doctor. Now, coming to the what do you do for living? And because in case he needs any sick leave and all, you need to know what type of work, and also whether he's exposed to what type of occupation, any exposure to any, because young couple, no, they may want to conceive also. So then coming to the support, how is the support? Do you have good support at home? At home, especially because the this thing, they may not. They need very good support. So they will, because they will be mentally stressed out also. So then, how about you? Do you feel down or depressed anytime? Have you felt down or depressed anytime in the past? Okay, now this is the history you have taken, information gathering you have taken, then moving on to the examination. After information, examination. Always take permission. So, because here the GP's letter, you see the image. You have seen the image, but the examination findings are not there. So you say, if you allow me, can I examine you in the presence of chaperone? My nurse will take the blood pressure and pulse rate, and I will check your tummy and also down below. So I will examine your tummy and down below to see what type of swelling you have and how big is the swelling and where is it exactly. So can you proceed? Yes, yes, doctor. So then that is about the examination, general physical examination for abdominal speculum and that. So now coming to to know the size of the swelling, and sometimes only one swab is taken. Gonorrhea is there. Suppose you want to rule out some other infections also, you can tell that you would like to rule out other infections also, you want to take the swab. But usually once this takes swab, that is already gonorrhea, along with gonorrhea, others they will be ruling out. So swab, no need actually, because only swab report is there. But if it's not there, you need to take. Now, coming to the discussion, that's super. Would you like to add anything? Always end the information gathering with a question. Would you like to add anything? No, doctor. So now coming to the applied clinical knowledge, you want to. So then, so let me tell you. Suppose you are going to examine her, examine him, and say that she allows. Then you say thank you for allowing me to examine you. Okay. Then coming to the discussion, you want to explain. You have to explain what is the condition. So now coming to the discussion, Jack, let me tell you from your history and from the examination. Yes, you have done an examination, no? Examination, and from the reports what the your GP has provided to us. I confirmed on the reports. I confirmed your name, age, and NHS number, and they belong to you. That is Jack and 30 years and NHS number. So they belong to you. And I can see that the swab shows that there is an infection with a bug called gonorrhea. It is a gonorrheal infection, and the urine report shows that there is no infection. And coming to the image, that image shows about the swelling which is there. But I would like to, because I wanted to see how big it is, whether there is any difference from that, I have done the examination. So from your history and from the examination, and I can see that there is an infection in the gland. There's in the gland situated down below in the birth passage, on the outer lower part of the birth passage. That is called Bartholin gland. So you have got an infection of the Bartholin gland. So let me draw and show you. Always you have to draw and show in the applied clinical knowledge when you are explaining to the patient. Always, because patient she doesn't know anything medical. So when you draw, she will understand better. And so now these are the two you're drawing and showing. The paper will be there on the table. You are drawing with a pencil. So these are the two glands in the lower part of the vagina, opening into vagina by small ducts which secrete fluid, and during intercourse it acts as a lubricant. So then sometimes what happens? These ducts can become infected. Like what infection now you have got, they can get infected there, and then it get blocked. And then once it becomes blocked, the free flow of secretion will not be there. So then it becomes big, the gland becomes big, and slowly it enlarges, forms a cyst. But if there is no infection, it becomes a cyst. But if it becomes infected, then it becomes pus. then the infection leads to pus formation, and this causes the enlargement of that swelling and pain. It causes severe pain, fever also. So fever there and sometimes fever in the tummy also, and there can be pain when you pass urine also. So all these things can happen when there is an infection. So now, so doctor, what is there any treatment for this? What are you going to do for me then? So then you say, see, now we have got a team of doctors with us. We are here to help and support you. See, Jack, we have got a team of doctors that is called a multidiscipline team, and that is our consultant. The consultant gynecologist is there. This is your gender specialist. Your gender specialist also will be involved, and specialist midwife. I mean, the nurse will be the specialist. Nurse will be there. Pain clinic specialist also. We will, because you're having severe pain. Sometimes we need to involve them all. They will also look after you, and so that is. These people will be involved in your care, and so then lab people, and sometimes we may have to involve lab people also, and sometimes we may need to go for special imaging, then we will involve the imaging doctor also. Now, can I explain to you the treatment, how we are going to manage? Otherwise, he also will say, Doctor, how are you going to treat me? Anything. So you say, first of all, we'll give you some painkillers, because you have severe pain. We'll give you the painkillers. They're simple medications. Usually they will not cause much side effects, but sometimes they can cause some gastric irritation, that's pain, some irritation in the tummy. Then when we will also rule out allergies. We already asked you that you don't use, and you said you don't have allergies, so we'll give you painkillers. And second thing is, because the report has shown that there is an infection, so we will give you antibiotics after ruling out any allergy. So Jack, am I clear so far? Yes, doctor. So we will give you antibiotics specific to this infection, that is the gonorrhea. We usually give the antibiotic called ceftriaxone. And then first we will give you the injection. Then we will after that we'll give you tablet called doxycycline and metrogyl. So these are the specific drugs which we give to this specific infection, because you have got that gonorrhea. So then you have to complete the course. And then afterwards, we will check the test of cure also. That means we'll check the infection has completely gone or not. Then second thing, we will send some blood test also, Jack. That is to know your blood strength, and also kidney. We want to check the kidney and kidney function and liver function also, and also sometimes the glucose levels also we need to check. Then then we will connect you to the gum clinic. We have a clinic called gum clinic, that is genitourinary medicine, where they will screen you and to check for other infections, screen both of you. They will usually screen both partner and also you, and to rule out other infections. Then we will also connect you to the gender clinic specialist, your gender clinic specialist, to get the to review a case. Now we'll give you. Now we have started the antibiotics, so Jack, we'll see whether how you are improving. After 2 to 3 days, if you suppose you don't improve, then in that case, if the fever, or suppose the pain starts increasing, swelling increasing, and fever doesn't increases, then you have to get admitted. We need to admit you. Then what are you going to do, doctor, after admitting? So we will admit you, and then we will inform our consultant and also our surgeon, and then the surgeon, sometimes they may give a small cut. They will examine you. Then if they think that the pus has formed, it becomes as an abscess, we'll give a small cut and then drain out the pus which is there, which is collected. We'll remove all the pus and put a small tube with balloon into the sac to drain it. We will keep this for 4 to 6 weeks, so that till if it still it heals. Sometimes there can be some bleed. So this is what we do. With this, it can heal. So sometimes with this procedure, there can be excessive bleeding also, because there is infection, and there can be pain also, but we will give you painkillers. Am I clear so far? Yes, doctor, but will it happen? Will I get again this in future? No, it can come in future. It may not come if the infection is completely eradicated or removed. But sometimes what happens, it can come again. If little bit of bacteria remaining, it can come again. Then what will you do, doctor? Then I will make a cut, and then we will edges will be stitched, and so this stitched out, and then a pouch is created. We create a pouch like this. Draw again and show. So cut is made. Edges will be stitched, and a pouch is created. This is called marsupialization. Marsupialization. Am I clear? Like this, it is done. You show the diagram. So that is then I will not get any more doctor in my life. No, in sometimes it can come again. In that case, if it frequently comes, we have to remove total gland. So this is what we are going to do for you. So am I clear? So now what you do, we will we'll start. We'll give some blood. You need to give some blood sample in the lab. Then we will start the antibiotics, painkillers also. Continue the painkillers until you get pain, and stop it when the pain subsides. And then antibiotics, you take it for as a course. We will give the prescription, detailed prescription. It can. So then second thing, we will refer you. We'll give an appointment with my consultant, so you can come down and discuss with show you, I mean yourself, whether you're improving or not. So he will examine you. And then third thing is, we will also refer you to the gum clinic, and so that they will rule out other infections, which I already explained to you. And we will refer you to the general gender assignment clinic or development clinic also. That is your gender specialist, who will review your case once again. And if you permit, I'll write back to your GP, because he referred you to us. Just give him the feedback. We would like to write back. And also, if you feel that you are psychologically upset with this, we will refer you. We will we'll connect you to the counselor. What do you say? What do you say, Jack? Yes, okay, doctor. So is this fine? Do you have any other concern? No, doctor. So now I will document whatever we have discussed. I'll give an information leaflet about this condition, what we have discussed. You just go through, so you have more idea. I'll connect you to the support group. And then I'll give an appointment also. And also I'll give you a 24-hour contact number. Anytime you feel pain is increasing, severe pain, and more of fever or feeling unwell, anything you feel, you come to the accident emergency. So that you will get your immediate attention. So now, so you already asked about whether he has anything else. So he said no. Do you have any other concern? If you have forgotten, now you ask. Do you have any other concern? No, doctor. Am I clear? Yes, doctor. Make sure that whatever you explained to him is clear. Done. Thank you for talking to me, Jack. If you remember the name, you say. Otherwise, don't say. So this is about this case.